Welcome to the channel. Before I get started, a couple things I would like to ask from you. I've been doing these YouTube videos, bringing out content, bringing out information, talking about medical topics now for going on 6 years. I want to be sure that all of you who have gotten anything from this, learned something, was stimulated to ask questions of your physician when you see them based upon some of the information you got here, hit that subscribe button. Hit the like key so that you can let us know that we are putting out information that's helpful and useful and things that you're interested in. And also hit the bell notification. I'm not ready to quit yet, so I'm going to continue to roll out new information week after week, and hopefully it'll be something that you'll be interested in, but you'll be first to hear about it if you hit that bell notification. I have another announcement I want to make. You see, I'm dressed a whole lot differently than I usually do. Usually I'm on my scrubs and coming off of work. I retired recently from the emergency department. After 34 years of working in emergency medicine, I decided that it was time to hang that portion of my medical career up. Now I'm working solely in my office as well as a medical directorship over the county jail. And as such, I get dressed like a real doctor now. I don't have to worry about getting called down to the emergency room in the middle of the day or in the late evening hours to handle something that requires me not to be in dress clothes. So if you notice the difference and you like it, also give me a like. We'll see whether or not we'll continue this or whether I'll go back to wearing more casual clothing. The topic I want to talk about today is one that I was asked to actually do a live interview for a local news station on, and that's hypertension. Hypertension is one of the leading causes of morbidity and mortality in this country. By definition, if your blood pressure is consistently above 130/80, you have hypertension. The question is how severe it is, what it does to your body, what risk factors are associated with it, what things that you can do about it, and whether or not it's something that you can actually reverse once you start treatment, or whether it's something that once you start medication for high blood pressure, you're committed to it for the rest of your life. Let's start from the very beginning. Hypertension is a combination of a number of different factors. Elevations in your blood pressure can be situational, meaning that if you're under undue stress, if you have been suffering from an acute illness, if you're participating in medications or even street drugs that cause your blood pressure to go up, that does not mean necessarily that you have sustained or primary hypertension. If you are removed from that environment, you stop smoking, you stop drinking alcohol excessively, you stop using amphetamines if you're using amphetamines, or stimulant prescription medications in the form of perhaps ADD medications or certain diet pills, then that blood pressure should normalize. However, if you're a person who has a positive family history of hypertension, parents, brothers, sisters, grandparents all had high blood pressure, and then you expose yourself to a stimulus that unlocks that genetic predisposition, that blood pressure can go up. And then you develop sustained elevations in the blood pressure that, if evaluated by a primary care physician, should be done on 3 sequential visits during a period of time where the blood pressure is taken in a quiet environment after you've been sitting quietly for at least 1 minute. And if it remains above 130/80 on 3 sequential visits, you qualify for the diagnosis. Now, at 130/80 or above, that is grade 1 hypertension. That's the early signs. There is an elevation in blood pressure called elevated blood pressure that precedes the actual diagnosis of primary hypertension. And that's when your blood pressure exceeds 120/80. Between 120 and 129, you're in what we used to call prehypertension, but now they call it elevated blood pressure. Once you cross over 130 to 149, then you've got grade 1 hypertension. Greater than 149 to 180 is grade 2. If you have elevated blood pressure above 180/120, you have severe hypertension, putting you in the category either hypertensive urgency or hypertensive emergency, which can either cause acute symptoms that can lead you into an emergency department and require emergency intervention, or put you at high risk for those complications. Well, when you first are diagnosed with hypertension, there are a couple things that you should expect that your primary care physician to do. Number one, discuss with you dietary interventions, non-pharmacologic interventions to help get your blood pressure under control. Well, what are those? Well, number one, reducing or eliminating stimulants that you may be ingesting in the form of your diet or things that you may be doing in forms of smoking tobacco or tobacco products, which are stimulants. Nicotine is a stimulant. Caffeinated products, caffeine is a stimulant, can increase your blood pressure. If you're on other medications that can be stimulant in nature, whether they're diet pills or even ADD medications, those things can all run your blood pressure up. They want to counsel you about things that you can remove from your environment, whether it be dietary or pharmacologic, that can help reduce that blood pressure and prevent you from having to be on antihypertensive therapy. Your diet is very critical, both diet and exercise. What we know for a fact that if you've got the predisposition to hypertension in your family and you eat a high salt or high sodium containing diet, it causes you to retain fluid. That retention of fluid from the high sodium then increases what we call the vascular volume, or the amount of blood and fluid and serum that's contained within the blood vessels, causing dilation of the blood vessels, increased pressure on the blood vessels, and as a result, increased systolic blood pressure. You need to make sure that you're on a low sodium diet. We have a diet that we like to prescribe for patients called a DASH diet. DASH stands for Dietary Approaches to Stop Hypertension. It's low in sodium and chloride, higher in magnesium containing foods, and lower in fat. All of those things can help reduce the blood pressure naturally without you necessarily having to get on pharmacologic therapy. Additionally, regular aerobic exercise is very critical. Walking 30 minutes a day, perhaps 5 days a week, helps dilate open your blood vessels to improve the supply of blood, which is oxygen rich, to your muscles, which are being asked to do more work by regular exercise. That in and of itself will bring your blood pressure down. Sustained exercise leads to sustained reductions in your blood pressure. It's a good practice. Doesn't cost you anything at the pharmacy, and you don't have to worry about side effects. The other thing that you can do prior to getting placed on medical therapy is be sure that you're getting regular sleep. Why is that so important? Well, if you're not sleeping regularly, if you're not getting about 7 hours of sleep a night, your body excretes a hormone from your adrenal glands called cortisol. Cortisol leads to constriction of the blood vessels, as well as an increase what we call contractility of the heart, forcing the heart to pump more vigorously. The combination of constriction of blood vessels and a more pronounced heartbeat leads to elevations in your blood pressure. Over time, that can be sustained elevations leading to hypertension. In this case, particularly if you've got a hormonal disorder called Addison's disease, which is an excess secretion of cortisol from your adrenal glands, you can have what we call secondary hypertension as a result of that hormonal imbalance. But restful sleep is very important in terms of blood pressure management. Now, if you're doing all of those things, but your blood pressure is remaining elevated, then initiation of pharmacologic therapy is indicated. Why? Why is it important to even lower your blood pressure? Well, with each beat of your heart, if your blood pressure is elevated, all the studies show that it causes shear forces on the lining of the blood vessels. Shearing forces that cause damage to the small layer of cells that line the internal portion of your blood vessels called the endothelial cells. Those endothelial cells, when they are stressed, when they get damaged, they secrete hormones that actually lead to worsening constriction of the blood vessels and at the same time initiate a process called atherosclerosis, where you start getting deposition of calcium and deposition of white blood cells into the walls of the blood vessels, leading to narrowing of the blood vessels, which can increase your risk of occlusion of blood vessels, which over time leads to organ damage. That's why hypertension, uncontrolled and untreated, can lead to problems with kidney failure, blood flow to the kidneys, can lead to increased risk of heart attacks as a result of blockage of the coronary arteries that supply blood and oxygen to your heart muscle, and it can lead to increased risk of stroke. Decreased blood flow to the brain can lead to a blood clot forming there, leading to an ischemic infarct or a stroke, leaving you with debility that could have been avoided if we just caught it early and treated this very serious but very treatable underlying cause. There are very few cases where we can't get a person's blood pressure under control. There are exceptions to that, but usually not with primary hypertension. But it takes a team approach. It takes you working with your physician, following their recommendations for changing your diet, lifestyle modification, increasing your exercise, trying to get more consistent rest, as well as being compliant with medical therapy when it's indicated to get that blood pressure under control and keep it under control. Now, once you're on medication, does that mean you'll never come off? Absolutely not, because of what I just talked about. If you can get on a better lifestyle program, which leads to more consistent exercise, better sleep, more healthy diet, what will result is a natural drop in your weight. You're going to lose weight as a result of that. And that weight loss actually decreases the secretion of some of those other hormones that I was talking about that can lead to elevations in the blood pressure. So by doing the things that you can do and allowing your physician to be a bridge, if you will, from where you start to where it is that you're trying to be, you can reverse hypertension just like you can reverse diabetes by doing some of these same things. Hypertension is a serious problem. Unfortunately, in this country, studies have shown that we're not doing a very good job of controlling it. About 70 to 80% of patients diagnosed with hypertension are not at goal. Well, what is a goal blood pressure? Once you've been diagnosed and started on therapy, the goal is to keep that blood pressure below 140/90. The lower, the better. The lower it is without you becoming symptomatic, meaning getting lightheaded and dizzy when you change positions, excessive fatigue, syncope or passing out or feeling like you're going to pass out with body changes, the lower you can get, the less damage to those endothelial cells inside the blood vessels, and the less risk you're in terms of long-term complications of the blood pressure. So that's a lot. That's a lot of information. We're going to give it to you in little pieces though, okay? I hope that you learned something from this. If you have a history of high blood pressure, make sure you're getting regular checkups with your physician so that he can work with you to try and optimize your treatment and use as little medication as possible based upon how much lifestyle modification you're putting into the process. God bless you. I wish nothing but the best for you. And again, let me know if you like the outfit. Take care.